Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, we are so super excited to have you here because we bring exciting conversations with leaders who are painstakingly shaping the future of healthcare. And we happen to be crazy passionate about healthcare innovation, adoption, leadership, and access. And if it's your first time tuning in, let me just tell you a little bit about what we do here. So we're a healthcare innovation focused company. We're bringing stories of innovation within healthcare to life. And our aim is highlighting real people that are truly innovating within our space and giving them a platform to share their stories with the world. And if you haven't checked out any of our historical episodes before, make sure you pause, hit the subscribe button now so that any new content that comes over to you will get right over to you. We've got an action-packed year, some amazing new content, and interviews lined up. So today we're incredibly fortunate today. We've got a guest with us who truly epitomizes what it means to be at the forefront of healthcare innovation. Please welcome Dr. Natalie Jones. She's a workforce solutions innovator and disruptor who's currently the Senior Vice President of Clinical Practice and Innovation at ProLink. She's known for her influential and results-driven leadership. She carries an impressive portfolio and track record within her career. She has a deep understanding of the technological and business side of healthcare, and her career has demonstrated thus far her capacity to drive change and bring about meaningful results by focusing on human resources, clinical quality outcomes, and operational process implementation. So sit back as we delve into this rich conversation with Natalie and just learning about her career, her story, her experiences, and how she's continuously working to evolve and innovate. So Natalie, welcome. We're thrilled to have you with us today.
Thank you, Michael.
Yeah. So let's take a step back and let's unpack a little bit of your story because you have some pretty awesome tours of duty that you've done prior to where you are now. Let's unpack those a little bit and then let's talk about how you use those experiences and are innovating today with many of the clients that you're working with.
That's great. So I started my nursing career about 25 years ago. I know I always date myself when I say that. Tell people, I was born in a hospital and never went home. But truly have spent the initial phases of my career in a cardiac institution in Columbia, South Carolina, and then moved to Mobile, Alabama, worked in the ED for a while, and then knew that I wanted to really move to Atlanta, which was at a half point of both my husband and my hometown, and was able to take a travel assignment to come to Atlanta. And I did quite a bit of traveling at that point in Atlanta at several large organizations and landed at an LTAC, which is long-term acute care, something that I at the time had no idea that existed. And that's really where was tapped for leadership and tapped by some incredible leaders who are still my mentors today to do quite a bit around nursing recruitment, retention, and really just led from the seat that I was in as a nurse manager, as a unit operations manager, and was really being recruited away. And there was a new leader in human resources who had been used to having a nurse in HR and asked me if I wanted to come and become a nurse recruiter or lead nursing recruitment, and was a little bit offended and thought, who on earth would do that? Who would want to go into nursing recruitment of all things? And he said, no, I want you to really think about how you could be the chief retention officer here. And, I got to thinking even more, how could I really influence the industry and really truly that organization, and took him up on that challenge. And at first started out really overseeing nursing recruitment and retention, and had done quite a bit at a system level to support those efforts, and then expanded out into really what was workforce planning and retention for that organization. Wasn't looking, went to spy on a competitor, um, and got swept off my feet by that competitor, Wellstar, and really spent about 8 years there, really over the last 8 years, I should say, and really was not necessarily looking to leave Wellstar at all. A great organization, had done quite a bit of work in workforce development, in onboarding, in talent acquisition, in academic practice partnerships, have been given the opportunity to do so many things to really change the landscape of not only Atlanta, but really across the state, and shared our learnings nationally. And really got swept off my feet by ProLink, because this allows me the opportunity to really work nationally and truly internationally, because of the work that we do from an international nursing recruiting standpoint as well. So really glad to be here to share more about my story as well.
Amazing, amazing. You mentioned something around being the chief retention officer. I'm curious as to why maybe there aren't more roles like that are out there, given that the staffing crunch and crisis has been around for some time. Based on your history and your experience when it comes to retention, I'm curious, what did you think are like the top two most important things when it comes to retaining talent?
The top two most important things are really the intentionality of leadership, and ensuring that you have that as a leader, we really are the reason many times our teams show up in healthcare every day. How are we treating our people? What are we going to bat for? What are we really truly, what kind of experience are they having? The availability, the authenticity of leadership, all of the trust, all of those things are truly impactful. I think secondary to that are, how do we help our teams to ensure that there's a balance, and that there is a positive work environment and a healthy work environment? Because again, just being really intentional in that space. One of the things coming out of the pandemic has really been the fact that it's shined a lot of light on the fact that we have just some opportunity to refine the work environments, to address bullying and incivility and lack of respect in the workplace, really truly trying to attract people to nursing, in particular, into healthcare. Really, when you think about the environment, is that really something people will want to show up for if they're going to be not treated well, and deal with all of the other things that go along with it? And the stress and burnout is really truly what is at the core of some of those that have left the profession, even during the midst of the pandemic as well. And earlier today, I'll just say, we're preparing a white paper that's going to come out soon on mental health. And as we were trying to really narrow down the shortage and think about how many nurses do we truly need in order to address the shortage, the number is astounding in terms of the gaps and the wide variety of what you read in the literature. It's anywhere from 65,000 to 1 million in the new US, and anywhere from 3 million to 13 million worldwide. And every single country is citing the exact same thing: the work environment, the stress, the burnout, in terms of why nurses, not only here in the US, have left the profession, but why they've left the profession in every country known to man.
So this causes a very interesting predicament, because if we're talking about work environment and culture, I'm sorry if those leaders that are out there, but that falls on our shoulders. So is this our own doing? And what have you found, not only just currently what you're doing, but historically, what led to creating good environments? What were some of those things that you implemented? And they don't necessarily have to be groundbreaking things, but do you mind sharing some of those, or maybe even sharing some examples of what got things to sort of turn around?
Absolutely. I'll speak to, in the last role I was in, that had really an indirect um, responsibility for retention, was really to we embrace the magnet culture, which is don't do anything for me without me. and ensuring
Mm,
that nurses can identify those things that are really truly, what is it that is the issue? Is it compensation? Is it your leader? Is it your environment? Is it work-life balance? Is it the fact that you need more stress relieving techniques in the workplace? And having some customization and some menus of options and some thoughts around how we can ensure that there's also a flexible work schedule. How are we supporting working parents? All of those things, but really having the voice of customer and not cookie cutting exactly what you believe should be happening for nurses or should be happening for clinicians is just key. Is something that's very practical in terms of no one size fits all. So I think what worked for Wellstar may not work for Mayo Clinic, may not work for Cleveland Clinic, may not work for University Hospital in New York, wherever it
yeah.
is, but you just really have to have the voice of the nurse, the voice of the clinician to really help you to understand what is it that is impacting retention within your organization, whether that's engagement scores or trust scores. We just did so many things to just make sure that we were customizing. And what happened on one area of the hospital may not be something that would be applicable to some other areas just because of the different unique characteristics of nurses that work in certain areas
Yeah.
and also the diversity within those areas, whether that's ethnic diversity or age diversity, quite frankly,
Yeah.
because the operating room may have different issues than med surge, for instance. So those were just some of the things. I know that seems really vague and kind of practical in nature, but all of that really factored into our workforce stabilization efforts. Even prior to the pandemic, we were very intentional in how we looked at data and how we use data to drive decisions.
And dig into that a little bit in terms of the data. How often would you listen to the voice of the customer? What did that look like? And then talk about, because there's a lot of data points that you can use, and sometimes there's a sea of data that you can't actually see anything. Can you maybe share what pieces of information you felt were most important in order to sort of actually take action on?
Absolutely. And I'll talk a little bit about Wellstart, and then I'd love to share what we're doing at ProLink, which is
Yes.
exciting. So definitely in my previous role, looking at trust surveys, which were once a year, but also we did pulse surveys to really look at that. For our nurse residents, we actually checked on them quarterly. We were constantly in communication with them using the Casey Fink tool, which is a pretty well known nurse engagement and new graduate engagement tool to really understand how they're doing clinically, but how is their confidence building or boosting in the clinical environment. So we use that. Fast forward where I am now, I'm very, very excited and happy about the way that we're looking at data. We use the Net Promoter Score, what we call NPS.
Hmm.
We look at it 30 days into an assignment, and we are constantly pivoting and reviewing and looking at that data on a monthly basis to understand how are we doing as an organization, how are our nurses viewing us as a company, but what are the things that they might need to enhance their experience, and then ensuring that we're giving that feedback back to clients is
Mm.
critical. How are we closing the feedback loop? Is one thing to gather data, but it's another to actually have a feedback loop and close that, and really using plan, do, check, act, just plain old process improvement and continuous process improvement to solve problems, and using that data to really guide us in terms of how engage how we're doing and how we're improving.
So you're in this seat now, into this newer role, and so you've gone from being, I wouldn't necessarily say, so you were an insider, working as a provider. Now you're not. Are you viewed any differently from peers? And how does that change when you're trying to engage with clients and customers? Do they view you as a peer still, or do they use the dredged word of vendor?
Oh, that's a great question. I think that I my philosophy is so deeply rooted in relationships and connections. I think that's what you and I have in common, and it's just
Yeah,
so critical
yeah.
to connect clinician to clinician, nurse to nurse. I do still maintain that balance of vendor versus peer. And we do a lot of sharing, not necessarily sharing from a client to vendor to client perspective, but really sharing clinically. At the end of the day, that's one of the draws for ProLink, was that really was the greater good and wanting to really support healthcare. And so I think that I've got a good balance. People are still answering my calls, thankfully. Many are, I've gotten a few calls as, how did you get out too? How did you pivot out of healthcare in this traditional sense into more of a creative role? And we do a fair amount of consulting
Mm,
with ProLink as well, which we can really share some of those best practices. And again, connecting people, even if it's something that I may not have experienced in my prior life, how can I connect maybe this client or a former colleague with a client where they're really needing to exchange information to improve patient care at the end of the day. And that's the thing about nursing. I think we all signed up to really care and to make the world better, hopefully.
yeah.
But at the end of the day, I'm a nurse first. And so that really does help, and I hope that does, carry through into those conversations and people that know me.
Absolutely. That relationship equity definitely transfers over. In a previous conversation that we had, you were very intentional about the verbiage that you used around workforce. And I think historically, just call it what it is. Staffing agencies are just very transactional. Can you talk about the transition from the traditional agency model to how you're really now more focused on the workforce?
We are definitely focused on workforce solutions, and what we know and our clients and really the industry has told the world is that contract labor is not sustainable. We know that. And we really have to be focused on innovative solutions that are going to really challenge the status quo. There are other industries that are doing things that we could actually learn from in healthcare too. So being able to apply some of those principles, but quite frankly, you know, we benefit when we do drive down agency cost. We really do, just from a healthcare perspective overall. And so I know that there have been thoughts out there and discussions about healthcare being or staffing agencies maybe necessarily not being a positive thing. We've really shifted more so into what we call workforce solutions, that is just not a one size fits all, that we have the ingenuity, the know how, we have the experts that really have done quite a bit to improve and to problem solve in a much different way, and to bring those solutions forward, whether that's international nursing, whether that's actually also just looking at your problems from a workforce standpoint and saying, you know what, let's lay it all out. And how can we help you, whether that's using Lean Six Sigma or our project management office to really solve problems, or maybe that is helping a talent acquisition team to apply best practices and evidence-based principles that are going to improve them. So I think it's just a matter of us bringing solutions to the table instead of really focusing on one aspect of the business.
Yeah, it sounds like what you're saying is inevitably you're not on one side and they're on the other side. You're on the same side of the table, and you're saying, okay, let's lay this all out here, and let's figure out from a prioritization standpoint what makes sense. I totally align with that. Over the course of the last several years, there's been in the digital health space, there's been many quote unquote unicorns that are focused on workforce. And I want to read a headline to you with a quote from someone, and I want to get your reaction to this. And the title of the article, which I think is very provocative, is "What Happens When Nurses Are Hired Like Ubers?" And there's a nurse that quotes, and she says, "You basically just hope that nothing goes wrong." That's what a nurse said about a shift that she picked up in a, I'm not going to name the app, but in an app. What's your reaction to that? And then how does an organization like ProLink that's focused on workforce combat that?
So love that headline. What happens when something goes wrong, or what happens when we use an Uber app, and that's really gig technology.
Nurses, again, when nurses are hired like Ubers, like, on this
With not
on
nurses
demand.
are hired like Ubers, which is really truly a gig technology, or allowing nurses to really look at short-term shifts and pick up things. I think my initial reaction is, there's always that sort of thought process of, we pull a nurse that we're concerned about quality and safety in that type of structure. However, there are there are national standards that have been set forth for nurses to really practice, no matter if they are licensed in that state, safely. There are things that I think that is where, during the pandemic, we really figured it out. We figured out how to allow people like myself, who haven't been in direct patient care in years, to go into a clinical environment and provide some level of workforce relief to nurses that were facing some very challenging times.
Mhm.
And it seems like our memory sometimes is somewhat short, and we get in our own way. So how do we ensure, would be my response to that? We know that the population has aged. We know that people can't work as long as sometimes as they want to. They may have other things that they're really trying to balance out. So how do we create an environment in the patient care sector, in the direct care environment, that would allow people to work short shifts, to come in and really relieve the workforce burden? We say we want all these things, but how do we remove those barriers and create an orientation that's streamlined? Do we have a statewide orientation where all hospitals have some standardization, and we know that from a policy standpoint, regardless, when you are licensed in the state of Arizona or in the state of Georgia or New York or wherever it is, that these are the standards, these are the foundational principles you have to know no matter what. And then what are those highly specialized things that you need to do, that you need to have in place on a unit? Do you have a super user nurse or a resource nurse that everybody can go to and ask questions? Are there standards in place? Is there a manual in place? Are there things that would allow you to really expedite an orientation for a nurse that is going to pick up those short shifts? And some of that does, again, kind of go back to culture sometimes, and mindset of nurses.
Yeah.
Unfortunately, I don't want to air all of our dirty laundry, but we do have sometimes a way of getting in our own way, as I said, but also eating our young and not always being as inviting to others that are coming in to help too. So I think there's some opportunity to kind of think that through, and create an environment that would allow that type of technology to be successful.
So it sounds like then it's kind of an alignment challenge in many respects. How do you then do that as you're approaching working with clients, making sure that talent is aligned in the right areas in the right way and in the right shifts? Can you maybe talk about some of those, whether they be streamlining things or how you've innovated in those areas?
Absolutely. Recently we had a client that actually had some questions about onboarding, and we were just noticing some themes and things that we wanted to help them to support along the way in terms of their own quality indicators or KPIs, whether that's falls or infections, or whatever those things were. And so we actually did come together and align a one-stop orientation manual, that not only are they able to use are we able to use for our travelers coming in, but also they can use internally for some of their team members. And because we have such a vast um, uh, array of people working on our clinical team, but we also are seeing things from a national landscape, and we can, you know, use some of our experience to really influence some of that kind of content, whether that's epic or epic documentation. I mean, those are the types of things that sometimes are pain points for people coming in because of the expectation around EMRs and documentation. So just thinking about that, that was one of the ways. We're also really thinking about how do we partner and really truly use our NPS data to guide us as well. So we've gone back. I mean, we get the voice of the nurse every 30 days, and we're understanding by client where are those pain points, what's working well too, where can we highlight, where can we compare, and where can we, you know, pull people together to compare notes too. So
Are you also
um,
capturing the voice of the customer, the end client? Like, hey, how did this work out? So are you kind of getting both sides of the story?
both
Because sometimes
sides
you
of
may get one side where it's like, hey, this is great, and then all of a sudden you get another side, the end client that you're trying to satisfy, and they're like, this was terrible. And somewhere in between there is probably the truth. But how do you leverage both of those two sides of the story?
you know, our recruiting team, we have client relationship managers that really oversee that process and do a phenomenal job of doing quarterly business reviews and staying close to the client and having um, client feedback sessions to better understand where we might need to focus and support their needs. Absolutely.
And then I guess in terms of where we are today, what has your attention and what has your intention as well for the remainder of this calendar year?
So, intentionality is key. We definitely are working on, as I shared, the white paper. We've got some really, really exciting things coming out with that, with the mental health white paper. Also, leader development is at top of mind. We've been engaging with numerous clients to actually teach nurse leader development training, because again, when you think about retention, many times the frontline leader is one of our greatest opportunities. We know in nursing, and Quint Studer and Katie Boston Leary just finished last year a huge undertaking to get some feedback on that. But we know from that work that about 1 in every 3 nurse managers has less than 3 years of experience. And so in that, training
Wow.
development is key. AONL is also focused on reviewing and understanding the nurse manager role even more. When I was a nurse manager, that hasn't been that long ago, but 10 years ago, the expectation, and it still is today, that you have 24/7 accountability. And so that's not really something that people are signing up for in 23. People are wanting to work less, not more. They want more balance, you know. And so thinking about those things and how we can work together to use AONL as really a guide for that training has been key. And really publishing and spending some time in the research realm is also something that we're focused on. We have a nurse scientist on our team that really helps us from a workforce perspective. She's the one really pulling together the NPS data, pulling together insights, sharing those insights, really educating our entire team, not only the clinical team, but the business minded side of the team, so that we can help that to drive our strategy as well.
Interesting stat. You know, the average nurse manager is 3 years or less of experience. That is very, very interesting
And that
to
speaks
me.
to the turnover. What I don't know, and Quint talks about this, what I don't know exactly is that years of experience in nursing or years of experience in leadership doesn't
Right.
really matter. You know, it doesn't. We're seeing clients that have new graduates precepting after 6 months. You know, that's been a whole thing. Charging, being the charge nurse after 6 months of experience or 1 year of experience, which truly in the literature, you're still a novice nurse, and there's no substitute, as you know, for time and circumstance. So when you think about the brain drain and nurses with 5, 10, 15 years of experience who we consider in the nursing profession to be experts, leaving the bedside, leaving the profession overall. And then and some of them that are aged, and can't work 12 hours on the floor anymore. So when you think about having shorter shifts or more or roles that could be maybe more of a resource role or a virtual nurse role, or a preceptor position to really help that next generation. Those are the types of things that it's really going to take to get us out of this bind.
Yeah, I think that, look, you can innovate within the circumstances that are given, right? You can take this box that, you have to operate within and innovate inside of that box. And I think some of the suggestions that you mentioned are formidable. What do you think is getting in the way of some of those actually being implemented?
If you talk to any healthcare executive, they're worried about staffing every day. That's what keeps them up
Yeah,
at. Well, I mean, half of your time is really spent in the business trying to really whack-a-mole. And so, having people committed, that was the difference, I think, in the previous role that I was in and where I am now, is having people that you pay to think. I worked for a CEO once that said, we pay you to think. We pay you to really take the time to solve problems here, but to also be proactive is probably what's missing most from most organizations. And I've been really gifted and blessed to work for organizations that have been intentional to say, you know what, we want someone to really think about innovation in workforce. We want you to think about how can we prevent turnover? How can we focus on retention? How can we create paths for people to improve their life so that, our organization is where they are for the life of their career. And if they don't want to be a nurse today and they want to be in the boardroom tomorrow, how do we help them get there? If they start out in environmental services, how could they be, maybe a CEO one day or a VP of HR one day? So there's just lots of opportunity to really think about that and to create a structure that would allow you to be purposeful. Our CEO, Tony, talks about ProLink being a purpose-driven organization. And it really does take leadership to lead the path there.
leadership takes time.
It does.
Leadership takes intentionality, and you're depositing into these relationships amongst your team. And, we're all given the same amount of time. And I think some organizations do a better job at actually depositing into those relationships to make people feel like they're part of a purpose-filled mission. And it's not just words, it's you see the actions behind it. Curious how with the nurses and the staff and the workforce that you're placing, do they get a sense of that purpose? And inevitably, do they want to continue to work alongside of ProLink, or do you find that you can somehow transfer that purpose into some of the organizations that they get placed at, and they end up maybe staying there a little bit long term and being a catalyst for change? How do you see that?
I think that is probably the more advanced work that we want to do, quite honestly, is ensuring that our clinicians can be catalysts for change in their organizations. And it's all about nurses leading from their seat and being equipped to feel empowered to do that. And I will say that many of the travelers, I think there was this understanding that there were a lot of new grads that were traveling. There are a number of nurses that have 2 years, 3 years of experience, but we have what I would call really career travelers, people that are really proud of that, of the work that they're doing and the ability to go in and make a difference. There's certainly a risk that they take on too, going into some of the environments and some of the
Right.
situations that they go into, and people understanding really what that risk is and how they can be a part of really solving those problems short term.
Absolutely. How can folks, let's just kind of put the spotlight back on you for a second. How can folks follow your work, follow the work of ProLink? What's the best way for them to just sort of follow the journey and follow some of the purpose-driven things that you guys are doing as an organization?
Awesome. Yes, we have, of course, LinkedIn is probably the best place to really understand the work that we're doing. Our website, there's been a lot of work there to really help people understand workforce solutions and the shift in the thinking and the work that we've been doing. I'm very active on LinkedIn. And then our organization also has a Facebook page and Instagram. But I think for this community, LinkedIn is probably going to get the most texture. I'm very active. I do like to collaborate a lot, and so would love to engage with people further if there's anything that you want to even talk about. I've set up calls. I probably have about three a month with just colleagues that reach out and say, "Hey, can we
Yeah.
just have a conversation? Can we just talk about what you're doing? How can we get started?" And it really just takes just taking just one step. You don't have to necessarily go and do an entire workforce development strategy tomorrow, but you certainly can start somewhere. And that's what it's going to take in order to improve the outlook and the future of healthcare.
Amazing. And if there's one ask that you would have of the advancing healthcare innovation community, what would that ask be? How can we best support and add value to you?
I would say, this new term, and it's probably not new to others outside of healthcare, but disruptive innovation definitely comes to mind. And really thinking about what are we doing that is existing that we could apply process improvement principles to improve it? Is that using Lean Six Sigma or A3 thinking or plan, do, check, act to just take what we have and tweak it? That is what I would ask because we are not going to solve for the nursing shortage alone. We also, my academic friends would say, don't forget us. Um, we've got to have more clinical faculty and more organizations that will partner with academic institutions to grow the pipeline. And we've got to make nursing attractive. We've got to stop complaining so much and complaining about 50 cent more for every little thing that we do. We want to make sure that everything that we do is actually helping to advance the number in the pipeline and keeping people in the pipeline. But young people, mentoring them and being a good role model. As a nurse, I've got three children, and I'm convinced one of them has to be a nurse. Two boys and a girl. I think I've got her on that track. We hope. I knew that I wanted to be a nurse since I was in, high school, but, role modeling in your communities, in your families, no matter what, that we're going to all grow older one day and we're going to need a very strong pipeline in order to improve. And I know that even though no matter what you read, sometimes the outlook looks bleak, I still see the glass half full in terms of what we can do and where we can go in the future.
Dr. Jones, it's been so nice to talk with you. And for those that have tuned in, if you found this content helpful for you, would you mind sharing it on social media and even just with your networks? We're grateful when we have folks come together that really care and have passion and have purpose. They want to drive healthcare forward. So it's been amazing just chatting with you. And my hope is that at some point in the future, we can have you come back on the show and give us maybe some more insights, some more key learnings, some wins, even some of the losses maybe, and sort of dissect those a little bit. But it's been a pleasure having you on today.
Thank you for having me, Michael.
You bet.